I hope there may be some of you left by the time I start to speak. Friends, good afternoon. I'm very proud to be standing here as a member of a party which is calling, as we've just heard, for an end to austerity and the consequent spending cuts that are wreaking such havoc on our public services and on the lives of the least well-off in our communities. Together with our allies in the SNP and the Greens, we will be the only serious force in Westminster after the election putting forward that demand, an end to the cuts, an end to austerity. As has already been said, it should be a key deal breaker in any support we give to any UK administration that emerges after the 7th of May. And let me tell you why. From the point of view of one neglected part of our country, Preseli Pembrokeshire. On Wednesday this week, 10 coachloads of people, that's more than 400, made their way up from the county to the Senedd for the third time in less than a year to protest at the continuing rundown of their district general hospital in Haverfordwest, Withybush Hospital. In fact, they've been campaigning on that issue for more than 10 years. 10 years in which we've had a Labour or Labour-led government in Cardiff. And it's a disgrace that after all this time, and under a Labour administration, key emergency services for a large population in a relatively isolated part of Wales should be still under threat. Leaving aside the immediate danger of people dying in ambulances on their way to Glangwili in Carmarthen or even further afield to hospitals in Swansea, the effect has been to make it more difficult to recruit essential staff. This creates a self-fulfilling prophecy for the administrators who say they cannot sustain services because they cannot get the doctors with the appropriate qualifications. And that comes, of course, on top of the detrimental impact on the morale of staff of all grades who are working in the hospital. Before Christmas, plans were leaked from the Hywel Dda Hospital Board to remove 24-hour accident and emergency cover from Withybush Hospital. At night time, if those plans had gone ahead, emergency cases would only be admitted in Carmarthen, 30 miles away. Of course, there was uproar, and the plans were shelved, at least until after the election. But the effect has been to make recruitment for this speciality even more difficult. Today, Withybush has only one full-time A&E consultant. The other places are filled by locums. Soon we will be told again that this is unsustainable. Since last summer, consultant-led maternity provision has been removed from Withybush to Glangwili, and so has the special care baby unit. And on top of that, consultant-led paediatrician care has been reduced to daytime only, from 10 o'clock in the morning to 10 o'clock in the evening. Let me tell you what that might mean for 6-year-old Nia McCall-Dorian, who lives in Fishguard. Last year, Nia suffered an epileptic fit. An ambulance took her the 15 miles to Withybush Hospital. Nia suffered seizures for 9 hours, and in all likelihood would have suffered brain damage or worse had it not been for the doctors and nurses who were able to attend to her so quickly. Despite medication that she's on, Nia still suffers from seizures. Today, her parents live in fear that she will experience a serious fit at night time, and then have to be driven 45 miles, not 15, 45 miles, and more than an hour away to Carmarthen, because there is now no nighttime cover in Withybush. Nia, her mother, and her sisters, they were all at this week's rally on the steps of the Senedd in Cardiff. They were disappointed, you know, that there were no Labour speakers to explain why Withybush is being downgraded. They were disappointed that the Health Minister, Mark Drakeford, was not there, so Nia sent him a postcard. But there were 2 Tory speakers, 2 Assembly members, Paul Davis from Preseli and Darren Miller from Clwyd West. And with breathtaking hypocrisy, I heard them speak. With breathtaking hypocrisy, they pledged to defend essential emergency services at the hospitals in their constituencies, despite the fact it's their own Tory-led coalition in Westminster that is forcing through the spending cuts that are to a great extent responsible. But the Welsh Government's Health Minister, Mark Drakeford, cannot put the blame entirely onto the London Government, can he? He is the one responsible for the organisation of the NHS in Wales. He has to bear the responsibility for the policy that is steadily denuding basic health provision from many of our most rural communities. In the Hywel Dda Health Board, Drakeford passed the buck to the chief executive, a man called Trevor Pert. He came a few years ago, hot-foot from Rochdale in England, where he had an established track record of axing services. Now Mark Drakeford has sent Trevor Pert, he sent him to the Betsy Cadwaladr Health Board here in North Wales, where he is raising his axe again. You know, Trevor Pert reminds me of Thomas Cromwell, as portrayed by Hilary Mantel in her novels Wolf Hall and Bring Up the Bodies. And who do you think I have in mind for Henry VIII? Why, of course, none other than Mark Drakeford himself. Following the final execution of our hospitals, I can imagine Trevor Pert running up to the 5th floor of T. Howell into the welcoming embrace of Mark Drakeford. But friends, we cannot allow that final execution to happen. We have it in our power in the forthcoming elections for Westminster in May and for the Assembly next year to halt Trevor Pert and Mark Drakeford in their tracks. We did it, you know, in Preseli Pembrokeshire. We did it once before. In the 2007 Assembly election, when Withybush was last under serious threat. In that election, Plaid Cymru stood under the banner of Save Withybush Hospital. It was on the ballot paper. And as a result, we won. We did much better than we were expected to. We got 25% of the vote. We even won a majority of the vote in unlikely places, such as Haverfordwest, precisely because of our campaign in that year on the hospital. And the result was, in that election, that Labour lost their 2 seats that covered Pembrokeshire. They lost Carmarthen West and South Pembrokeshire, and they lost Preseli itself. And in addition, Plaid's votes were helped to gain an extra list seat for Nerys Evans in Mid and West Wales. And those changes, those 3 seats that were changed, contributed to the electoral arithmetic that led to the One Wales coalition between Plaid and Labour, a condition of which was a moratorium on all the proposed hospital downgrades and closures across Wales at that time. Friends, we did it in 2007. We can do it again in 2015 and in 2016. Thank you very much.